Good day, S4OM community. Welcome to Conversations with the Oncology Care Team, a webinar series sponsored by the Society for Oncology Massage and the Society for Oncology Aesthetics. Our goal is to provide information to help massage therapists and estheticians support their growth as practitioners with enhanced knowledge of current oncology care options. My name is Erica Clinton, and I will serve as the moderator for our dialogue today with Dr. Ken Weiser. Dr. Weiser is a naturopathic physician based in Portland, Oregon. He is a cancer survivor who has a deep personal commitment to serving cancer patients with the intention of supporting the patient in a way that is reasonable, simple, and thorough. Dr. Weiser focuses his suggestions on diet, exercise, stress reduction, and evidence-based natural medicines. Thank you so much, Dr. Weiser, for taking the time to join us today. How are you?
I am great, and you are welcome, and thank you for the opportunity. I appreciate that.
Well, it's so wonderful to be able to talk to you. And the first thing I guess I'd like to do is help our audience understand your work. So can we start off with an explanation of the field of naturopathic medicine?
Yeah, naturopathic medicine is sort of a weaving together of pre-industrial, pre-drug medicine. It's sort of taking all those folk medicines that have existed for millennia and putting them together. So in the old days, you had a doctor and they would know you and ask you what you ate and how you exercised and what your stresses were, and they would use the local herbs and they would use food and they would use stress reduction and they would walk with you, or I don't know if they would walk with you, but they would prescribe exercise. So it's kind of it's like pre-industrial medicine in a way that really focuses on the individual as a whole in body, mind, and spirit. And also really the focus is on expansion of health, not using drugs to be anti-disease. So if you have depression, you get an antidepressant. If you have too much bacteria, you get an antibacterial. If you get immune problems, you get anti-immune drugs. So we're sort of probiotic rather than antibiotic. And I think that's a valuable heritage. And I think it's a very synergistic thing with drug medication and oncology, because, me telling someone to eat broccoli and walk is not going to cure their cancer. So they need oncology, but more than ever, they also need naturopathic medicine to support them in body, mind, and spirit to reduce the side effects of their treatment, to reduce the risk of recurrence, and to just be sort of that old-fashioned, I walk with you through everything kind of doctor.
Which I think is so much of what people want nowadays, particularly when they're facing a serious illness. That sense of collaboration and companionship in the work of healing, right? And I hear that so much from the oncology patients that I work with, that they appreciate that approach from their massage therapist. So I'm sure you see that tenfold in what you do.
I do. The biggest complaint I hear from most patients, no matter what their concern is their doctor doesn't listen to them, and he looks at a screen and doesn't take the time. So one of the most common things I say when people come in, I say, well, tell me your story. And I've already read their chart, so I know the medical side. And they say, well, I have breast cancer and I'm doing this treatment. I say, yeah, I know that. Yeah, thank you. Tell me your story. Well, I just did. No. Tell me your story from 4/12/57. And then they look at me like, huh? Really? Seriously? And then a lot of them say, well, you don't have time for that. I said, oh, yeah, I absolutely have time for that. And they're like, wow, you want to hear my story? And then amazingly enough, usually it takes 5 or 10 minutes for them to tell their whole story. And you get their story, you get the flavor of them, you get the important stuff. And I know you guys know this, as massage therapists, because that's what you do. And the greatness of you guys is you can listen with your hands too. I have to sit there in the chair and act like a doctor, but you guys can listen with your hands, so you can hear things that they can't even express in words, and that is the really good stuff.
Wow. So let me ask you a question. When you ask for a patient's real story, and I'm assuming 4/12/57 is like from the moment you dropped onto this earth,
Right.
what has been your story? How does that help you as a physician?
Yeah, it connects me with them. It humanizes the experience, and it also gives me incredibly valuable information. Well, I grew up and I was abused. Okay, that's important to know. Or I grew up and I always had ear infections and I had antibiotics for years and years and years. Or I have this stress at work and I comfort eat. So I'm 50 pounds overweight and I would like to not do that. Or I have cancer and my wife can't handle it and she just can't talk about it. It's like, oh, this is the stuff that's real in their lives. In a way, their diagnosis, their prognosis, and their treatment is, in a way, it's kind of abstract. Like they're pretty much in shock and awe the whole time. But the actual experience of life and the experience of doing the cancer dance is very unique and individual. And that's what I need. That's the keys to the kingdom right there. And also, when they tell their story, something powerful happens. They usually cry, and then they do this amazing, amazing thing. They give you their trust. They give you their trust. So when I say, hey, this is important for you to do, they trust that and they'll do that.
That's amazing. Very insightful. Very insightful. Thank you. So, what are some common misconceptions about your specialty that you might like to address or identify for us?
Well, some of the common misconceptions are from patients and then from doctors. And one of the misconceptions is that naturopaths just give a lot of pills. They just give a lot of natural pills, and that can definitely happen. The other thing is that, at least in the cancer dance, is that naturopaths aren't well trained in oncology. And that can happen too, because we don't have the rigor, we don't have 10 years of training like they do. We have our naturopathic degree, but I taught oncology at the Naturopathic College for 12 years, and it was all of one class. I mean, one semester.
Wow.
So it's a very complex field. So, there's concern that the naturopaths aren't well trained in cancer, that they tend to be sort of Wild West freewheeling gunslingers and give a lot of supplements and they charge for them and the insurance doesn't cover it. So what we've tried to do is completely set up a new model. And the model is we work in the hospital system. Literally, I mean, we're the first floor of the cancer tower. You walk in and there's integrative medicine. So we are in physically the same facility. We share electronic records. We go to meetings together. We go to tumor board together. We talk about patients together. We don't get remuneration from anything, any supplements we sell. We're very conservative about what we do. And we try to earn the respect of the oncologists and the patients. And we also try and make it super easy for the patients. So we have 5 massage therapists, we have 6 naturopaths, we have 5 just acupuncturists, we have a chiropractor. So we want them to be able to come to the cancer center and just have it all be easy for them.
That's pretty amazing. Because I know access for some people is the biggest challenge. They get recommended to do a lot of things, but if they can't find an oncology trained massage therapist, or they can't find a naturopath, or they can't find just a chiropractor who understands how to work with an oncology patient, they just can't get what they need, and that leads to a lot of frustration. So kudos to your facility for doing that, and making it, just as you said, easy as possible. And then they see you and they realize you're part of this whole process.
Yeah, I'm in the thing. Their oncologist or the nurse has recommended that they walk, they go from the 6th floor down to the 1st floor, and there we are. And the other thing that we've done that needs to be done more is we've integrated it in financially. So instead of, going to an independent contractor where you have to pay out of pocket, we've spent years where most of our patients are covered by insurance now. When I started at Providence 21 or 2 years ago, 0 of the patients were covered. It was all out of pocket. And now almost everybody's covered. So that really, 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 really helps to make it financially supportive of patients too.
That's amazing. That's amazing. So, quick question for you. Obviously, your focus is oncology, but could you be somebody's primary care physician?
There's 2 answers to that. The first answer is no, because in the hospital system, we are considered specialists. And so we can't be primary care because we're specialists, like a nephrologist or a neurologist would be a specialist.
Gotcha.
So in that technical way we are, but being naturopaths, we're trained and we treat people for everything. And also when you're treating people in the cancer dance, it's not like you're just treating side effects of cancer, you're treating the person. So, maybe they haven't been able to sleep for a year, or maybe they need to lose weight, or maybe they've got, GERD or something else. So, I'm not a PCP, but I'm a naturopath, and we try and support people in that way.
So, with an oncology patient, the kind of benefits of a naturopathic approach, are they mostly about side effects to treatment, or is it kind of a broad spectrum of things?
There is a spectrum. There's the sort of the center of the spectrum, which is the main thing, which is people going through treatment. So people going through chemo, radiation, surgery, immunotherapy. How do we get them through that with the least harm possible? And then there's also people that come in who refuse treatment, who refuse to do oncology, and they want support to be as healthy as they can be and to live as long as they can. Either they can't handle therapy or for whatever reason, and so we try and do that. And then of course there's people who have finished therapy and they have problems after therapy, and so we deal with them. So we're with people from start to forever. It never ends.
So, what do you find to be the most challenging part of working in healthcare? The big,
uh, the most challenging, I know this is sort of silly, but the most challenging thing is being an incredible minority, is being a naturopath in a integrative clinic in a hospital, and having this demand and never having enough people, and never having enough people in Portland to support these people, and certainly in America. So it's kind of frustrating that, being a cancer patient myself, my mission is to serve cancer patients and to make supportive care available. It's certainly a lot different than when I started my cancer dance 35 years ago, but it's still such a minority. And there's, the number one thing I hear from patients is, God, I wish I knew about you guys sooner. And that just breaks your heart. So I guess that's the frustration is, things are changing, but they're they need to change more.
so if we go with the flip side, what's the most rewarding part?
Oh, always the most rewarding part is that person sitting in front of me. That's what it's all about. I tell people and they think I'm crazy and they think I'm lying, but I tell them, going back to what I said is, tell me your story. Well, you don't have time, you're too busy. And I say, no, I have time. And, well, really? And I tell them, you're my only patient.
Mhm.
You are my only patient. You are the reason that I sat on my duff for 4 years in medical school and left my career as a filmmaker. You are the reason why I've done this, and I've been learning as a doctor for 25 years. You are my only patient. And that's really it. You're in the room with a person, and they're vulnerable and they're wonderful, and it's just such a human experience to do that, and then to think, wow, maybe, just maybe, after 4 years of school and 25 years of practice, maybe I could be of some help here. That's amazing. So that's what it's about. The rest is irrelevant.
Yeah. Yeah. I mean, you mentioned how much we as massage therapists get to listen with our hands, but I'm always amazed at how gratified I feel just because I got to bear witness to another human being's experience, good, bad, ugly, wonderful. And that's my work, right? That's my job, that I get to do that for people. So I can totally appreciate that feeling, that sense of it. So you working in integrative medicine, can you give us an idea about how we, and I guess the bigger picture of we, of those of us in healthcare, can be better at collaborating with each other as we support people who have cancer?
So you and I have thought about this before,
Mm-hmm.
and and I thought about it after we talked about it, and I thought our conversation was good, and the first thing we talked about was essentially do your homework, and find an oncologist, or oncologists plural, that want to refer their patients to massage, and earn their trust. Show them your credentials, show them your passion, show them your training, and then show them that you've helped their patients and haven't done harm and you know what you're doing. So build a relationship of trust with oncologists, and then find other people, and of course, including, if you can, a naturopath who works with that oncologist, who will work with you. So build a team. It's more than sending emails. It's more than texting. It is a face-to-face, here I am, here's my being, here's my passion. Please, let's work together. It's a human thing. You've got to spend the time to develop a team, and then you've got to follow up. When they start sending you patients, you have to do the second thing, which is communicate. You have to communicate if there's something important that you found out, if there's a concern that you have. You have to send chart notes if they want them. So it's that kind of simple, old-fashioned creating a team. And it's not something that will just fall into your lap, because it's something you have to find out, and you have to do it with the intention of, would I refer my family member to this person? With that amount of commitment and seriousness, can I build a team that would support my mother or father or brother or sister? And that's what you do. And I know that sounds simple and obvious, but it's often not done. And the other thing, one of the other things we talked about is, please stay in your lane. If you're doing massage, if I refer someone to you for massage, please do massage. Please don't do anything else. Please do not become their therapist. Please do not become their naturopath and give them supplements. Please just stay and do what the team expects you to do, because that often doesn't happen, and that just destroys the whole team.
Yeah.
Doing touch therapies is plenty. There's plenty to do there.
No, I think those are really, really good points. And often, sometimes the best way to achieve this level of collaboration is through, again, this simple understanding of what we all do, and that we all do need to stay in our lane. I love it when the oncologist is like, I think you should have a massage, but I won't talk about the benefits. I'm going to let the massage therapist do that, because they know this inwards and outwards, and they can put a context to what they can do. And I think it all works better when we do that.
Yeah. What we call it is round table medicine.
Yes.
We're at a round table, and we all have a say, and we all have contribution.
Absolutely. So in terms of massage, why do you usually send your patients for oncology massage?
For two reasons. One is they need touch. The cancer dance is super stressful. And when you get cancer, you often get starved of touch. People are afraid to, they're afraid to touch you. Your partners are afraid to touch you. And also you just need touch. You need human touch, and you need somebody who can touch you besides your friends and family, because they have their own agendas and their own fears and their own intentions. You need somebody who can, like you said, just bear witness. That's a really powerful thing. So, I cloak it under stress reduction. Hey, would it be helpful for your stress to get a massage? Oh, wow, that would be amazing. And they go there and they get the little tinkly music for an hour, and they get to lie there and, fall asleep or not. And, it's just so amazing for them. And then the other thing is for symptoms, neuropathy, cramping, pain, lymphedema, insomnia, just, very specific stuff. And the hierarchy of therapeutics in my world is always start with the least harmful. Always start with, the most potential benefit and the least potential risk. And that certainly, the one of the foundations of that certainly is touch. Yeah.
Oh my goodness. Thank you so much, Dr. Weiser. This has been amazing. It's been so great to talk to you, to ask you questions, and to just see a champion of oncology massage. There aren't that many people who support what we do. That group is growing, but it's just really wonderful that someone who does the work you do appreciates what we do, and I thank you.
Well, you're welcome. Well, I'm a witness to the power of it, and I thank you guys for pioneering too, because it's not like you can go to the newspaper and find an entire page of one ads for oncology massage like you can for OR nurse or something like that. It's a pioneering field, and it's happening, and it has to happen. And the way it happens is exactly the way you're doing it, is, doing the work, forming societies, educating people, helping them be successful, getting the word out. It's just a slow, steady, beautiful, difficult story.
Thank you. Thank you so much.
Thank you. Bye-bye.